Hello and welcome to Building Better Health. I'm Terence Samuel. If you search for longevity, you'll find plenty of advice on how to live longer. Biohacking, wellness influencers, and new wonder drugs. It's a cultural phenomenon. But what we don't talk enough about is the longevity gap. In America today, how long you live isn't just about your choices. The biggest factors in your life expectancy are your bank account and your zip code. In this episode, we're going to dig into why that is, and more importantly, how we fix it. I'm joined by two remarkable guests. Dr. Eugene Hsu, Chief Medical Officer and Senior Vice President for Optum Home and Community Care Delivery, and Dan Buettner, a National Geographic explorer and founder of Blue Zones. He has traveled the world to find out why some people in some places routinely live past 100 years old. Let me start with you, Dan. Talk a little bit about how you got interested in what I know you've described as a mystery and how you ended up making this your life's work.
Well, I read in 1999 a Danish twin study that said only about 20% of how long we live is dictated by our genes. The other 80% is something else. So I got the idea to, in a sense, reverse engineer longevity. And working with National Geographic and a grant from the National Institutes on Aging, we hired demographers to look through worldwide census data to find 5 little spots on the globe where people have the longest lives. 5 blue zones. Longest lived women in the world, Okinawa, Japan. Longest lived men are in the highlands of Sardinia, the Ogliastra region. We found a blue zone in Ikaria, Greece, where people live 8 years longer with no discernible dementia. The Nicoya Peninsula of Costa Rica, southern Costa Rica, lowest rate of middle-age mortality. And then within the United States, the Adventist population, they're conservative Christians who are concentrated in and around Loma Linda, California. These people have the highest life expectancy at age 70 without chronic disease. And I reasoned that, if you could find them and then look for the common denominators or the correlates, you might have a pretty good
I would
idea.
say one thing is that they're all kind of beautiful vacation spots, but continue.
Mama didn't raise no fool.
Dr. Hsu, talk about kind of the model of care that your teams provide.
As an anesthesiologist, my bias is based on my training. I was trained to provide very focused physical medicine and a little bit transactional in some sense. Episodes of care are fairly short and acute and self-limited. What we find in my current role as the CMO of Optum Home and Community is that we get to see patients over a longitudinal spectrum. So we have multiple care models that take care of patients over a much longer time period. And more importantly, we're bringing the care to them in their home setting. And you get to start your surveillance with the environment that they're in, with the social factors that they deal with some of the access barriers that they have. One of the home visits that I got to go along with one of our nurses, despite having, sort of a secure doorway, bars on the windows, the door was unlocked. And the door was unlocked because this patient who was bedbound and had severe advanced dementia, had a caregiver that himself had mobility problems and he couldn't get up and down the stairs. And so he just left the door open. And so we take that all into consideration when treating that member. We're able to, particularly for our highly complex members, assess and address all of those issues. And that is a sort of a privilege as well as like part of what brings me hope in terms of the healthcare system. I will tell you, Terry, what's so enjoyable about my job is that the people that really need that level of care, gosh, it can be life-changing for them. To be able to have that level of care, it will allow them to do more things with their family that they otherwise could not do. It will allow them a certain sense of stability and safety. And I would say that is rooted whether you're well or whether you have a chronic illness that you've been struggling with. That sense of safety and security is something that we all deserve.
Dan, define blue zones for people. Talk about it in the way that I've heard you do, which is it is kind of a way of life, and it's not just about kind of medicine.
So my daytime job, I run Blue Zones, and we have 73 cities in America that have taken Blue Zones on as a population health approach. And the key insight from the original Blue Zone work is if you want a population to get healthier, don't try to change its behavior, change its environment. And the idea is to set people up for success. America right now, we're set up for failure. The food environment, the built environment, pollution, et cetera. In our daytime job, we work with city governments and help them pick policies that favor healthy food over junk food, to favor the walker and the pedestrian over the motorist, and to favor the non-smoker over the smoker. We work with all grocery stores, restaurants, schools, workplaces, and churches in an entire community. And we offer them Blue Zone certification if they set up their designs and their policies to nudge people unconsciously to move more, to eat better, socialize more. And then in the community, we, especially in poor communities, we issue Instapots. I have nothing to do with the company Instapot, but it is a simple solution to quickly make healthy food. And there's this sort of obsession with, we need to get more fresh greens and vegetables in the inner city. No, we don't. People don't know what to do with them. They're not shelf stable. They're expensive. We need more beans and grains, which are, by the way, are the healthiest foods in the Blue Zones. And people know exactly what to do with beans and rice or beans and corn tortilla and how to make them delicious, and they're shelf stable. So we show people in inner cities how to make those simple foods taste easy, quick, taste good, and are easily made. And finally, there's a loneliness epidemic in this country, and our phones are making us more lonely. We actually have a program that simply puts people together, gives them a chance to know each other, who shares my values and my interests, and then we challenge them to walk together for 10 weeks. And you know what? We get about 60% of them that become long-term friends. So it's this environmental change.
There is kind of a paradox at the heart of this question, right? We talk about health and care, and for the most part, on most days, in most places, when we talk about healthcare, we're not talking about health. We're talking about illness. We're talking about pathology and how to fix that. And your work has been mostly about how people stay healthy longer, almost without the need for healthcare.
That's right. So Blue Zones specifically are places, there's only 5, and it's very specific criteria, very hard to make. And again, these people are reaching age 70, and they have the highest life expectancy at age 70. So in America, healthy life expectancy, something called HALE, Health Adjusted Life Expectancy, ends at age 64. That's the age at which an American can expect to have a major disability or chronic disease. In some of these Blue Zones, they're living 12 more good years beyond that, and those are years without type 2 diabetes, without many types of cancer, and without cardiovascular disease. And that's what we want. We want to live a long time. And by the way, when you're living those extra 12 years, your morbidity, your period at the end of your life when you're disabled, compresses. So they live a long time and die quickly. And I'm saying to the American healthcare system, it's health care. We should be caring for health. We should be looking at places that have achieved the outcomes we want and mimicking them. And we do almost nothing of what Blue Zones teach us in our healthcare system.
Dr. Hsu, there are a lot of diseases that people think are preventable. What is your sense of what needs to happen on that end?
It is very much an environmental and the environment all in, the community, family upbringing, education, as well as the healthcare system, public safety, right? Whether there's sidewalks, right, for you to walk.
Dan, you've been studying this for a long time. How do we start making that shift?
Understand that trying to change your behavior or rely on Americans to make better choices is a fool's errand. And if you look at the duration of an average diet, we've been sold the idea of diets for a long time. They have a half-life of about 3 months. So you start with 100 today, you lose 50 in 3 months, you lose 25 in 6 months. Great business plans, but they fail. Same with gym memberships. We start with a lot of zeal after the holidays. We run out of gas by September. Longevity hacks, even if they worked, and by the way, exactly 0 longevity hacks have been shown to increase human life expectancy. We wouldn't take it for long enough to make a difference. So what does work is shifting from trying to change behavior to shaping our environment. What do I mean by that? If you go from zero physical activity to just 20 minutes a day, it adds 3 years to your life expectancy. There's something called a complete streets policy that city councils can adopt that can easily, in a 3 to 5 year period, raise the amount of physical activity an entire city can get by about 20%. You'll never get that with gyms. Making it easy for people to walk to work, walk to their friend's house, or kids walk to school. You're going to engineer physical activity in at the population level where it's needed most, which is from 0 to 20 minutes, far more cost effectively than giving everybody in America gym memberships. Same thing with food. We tell people, it's your responsibility to make the healthy choice. But if you go into the food environment, 90 out of 100 choices are bad. You go into a grocery store, 80% of all foods in a grocery store are ultra-processed foods or foods with added sugar. And there's a $1 trillion food industry that designed that grocery store to drive you towards the ultra-processed food. You can't fight that. What you can do is create a food environment at the city level or the community level that favors healthy food over junk food and junk food marketing. If you're an employer, you can decide what's in vending machine, no sugar sweetened beverages, or you can shape the policies around what's in the break room or what's at your desk or in the conference room.
Talk about the social connection element of this, because in addition to eating differently and moving more, a big part of this Blue Zone success is the friendship and connection that you just mentioned.
Yes. So you have to realize two things. The first of all, and this is often cited, but if you're lonely, which is to say you don't have at least 3 friends you can count on a bad day, it shaves about 8 years off your life expectancy over being well connected. So just connecting people. Best pharmaceutical you can imagine. But the other thing to remember is that health behaviors are as contagious as catching a cold. In other words, if your 3 best friends are obese and unhealthy, there's about 150% chance that you'll be overweight. If your friends smoke or do drugs or even are lonely or unhappy, that's all measurably contagious. Nicholas Christakis, Yale University. So, New Year's Eve, everybody takes on a New Year's resolution. I say what you should do is you should open your address book, identify 2 happy, healthy people, and right there, invite them over to dinner, invite them off to have a cup of coffee, and start rebuilding that core social circle, which is going to battle loneliness. And if they're healthy and if their idea of recreation is playing pickleball or golf or biking, and if they're, vegan or vegetarian, which isn't a bad idea, that is all measurably contagious. You're more likely to do it. And that effect is going to last as long as you have them as a friend.
Do your practitioners, Dr. Hsu, need to start writing prescriptions for people to get new friends?
I would love to be able to do that. And as you know, probably, there is a loneliness epidemic here in this country. And very much so, it's an imperative that we have to fix in some way. I had a chance in just my area. Now, again, the closest Blue Zone to me, I think it's in my state, but it's a little further south from where I'm. And but I'm in the same state. At least we have some of the same characteristics, I would say. And as part of our house calls, I was able to do a ride along with one of our nurse practitioners, and I was able to be in the home of one of our patients that has a little bit of dementia, but like a fantastic kind of social network around her. And I actually got inspired because we were doing a little bit of a fall assessment, and I got to dance a couple steps with her just as part of an assessment, but just for, just for joy and for fun. And that gave me just a little bit of joy and a little window into the fact that she had an environment around her that had a lot of family. She was in a safe place, and she was getting cared for, including by our practitioner here. And what I will say is that the commonality there, the reason I bring up that example is that I do think the care and the trust that is built between our practitioners and those members and those patients that we have the opportunity to serve is a core foundational element of any kind of functioning community. And it can happen in the care delivery system as well. As in a blue zone where maybe it happens much more consistently across all different types of social relationships. But nonetheless, that's the same care.
Dan, what do you do about the friends who don't fall into this category? Do you get rid of them?
I wouldn't tell you necessarily to dump your old unhealthy friends because they need you. But I am just saying that when you look at the data of all the things we can do to get healthier, adding a new friend or two to your immediate social circle has more good evidence at making you healthy for the long run than anything else. I challenge anybody in this panel who can tell me a better long-term intervention for your health and happiness than adding happy friends. But we don't focus on it because there's no easy profit in it.
Can you give us an example of how and where this is working?
So we went into the beach cities of Los Angeles. We were there for 3 years. And during that 3 years, we persuaded city council to put in about 220 miles of bike lanes to make smoking, the ordinance against smoking outdoors as well as indoor, and it was actually enforced. And we created safe routes to school. The 8 schools there, exactly 0 of them had their kids walking to school. As long as you provide a safe way for kids to walk to school, we had about 37% of kids walking to school. My team was focused on permanent or semi-permanent changes to the environment, not to come in and eat your veggies. And now, 15 years later, Gallup measures that the BMI, or the obesity rate of that city, has dropped 25%. Smoking's dropped about 30%, and people report about 10% higher subjective well-being. And we've been out of there for about 10 years. And that is the payoff when we focus on changing people's environment, designing for a healthier America. The big problem right now, we spend about $5 trillion a year on healthcare. 85% of that is spent on treating cardiovascular disease. 95% of cardiovascular disease is avoidable. Type 2 diabetes, almost 100% avoidable. Dementia, at least 50% avoidable. About 40% of cancers are avoidable. We don't have to be living with these diseases. Incentives in the United States are lined up behind sickness. If you want to make money, a pharmaceutical company doesn't make money if you don't get sick. A hospital doesn't make money if you don't rent a bed and service. A doctor doesn't make bed if he doesn't make money unless you show up and need a procedure. In these blue zones, they have doctors and hospitals and pharmaceutical companies, but they invest most of their national budget on public health. So let me give you just one really great example. Costa Rica, Nicoya, Costa Rica is one of our blue zones. They have half the rate of middle-age mortality than we have in the United States. In other words, a 30-year-old or 40-year-old have about a 3-fold better chance of reaching a healthy age 95, which, by the way, is about the ceiling if we do everything right, about 95 years. Every man, woman, and child in that entire country has the right to something called a basic health team. That's called eBICE. 5 people: a doctor, a nurse practitioner, a record keeper, and 2 sort of mobile health ambassadors. That mobile health team is assigned 5,000 people. 5,000. And over the course of the year, that team goes to every one of those families within that 5,000 people. They screen you for type 2 diabetes. They take your blood pressure to see if you have cardiovascular diseases. They go in your backyard and look for standing water where mosquitoes breed. They go into your refrigerator and look for the type of food that breeds chronic disease. And they get you into the clinic 10 to 15 years before you end up in the emergency room.
Dr. Hsu, that sounds a lot like the care model that you have been working on in recent years.
Yeah, that's right. One of the fascinating aspects of it is we get people from all different walks of life at different stages in their journey. One of those, just to give you a flavor of the type of patients that we serve is in our medically complex kind of population. These are dual eligibles, meaning they're eligible for Medicaid benefits in their state, as well as federal Medicare benefits as well. And these particular members are really complex because historically they have poorer access to traditional types of care in primary care clinics or specialist clinics. And oftentimes we are the way that they receive care. We actually provide a longitudinal advanced practitioner that will provide that care in their homes. We try to meet them where they are. And especially for the most complex of them, we are aiming to treat the entire patient. So we are looking at social determinants of health issues where we can help with transportation barriers, with health literacy and education. We are also, in many cases, treating chronic physical diseases like congestive heart failure, COPD. We are also treating mental health in many cases, as well as coordinating with that patient's traditional care system where we can, to make sure that they're plugged into the right places within their community.
Are there Americans who don't live in blue zones, most of us, who are actually meeting this longevity standard that...
Yes, there are people with heroic discipline who can avoid eating too much ultra-processed food and meat and cheese, who can get the exercise, who stay socially connected. But they're swimming an uphill battle here in the United States. The number of fast food restaurants has gone up by a factor of 25. The amount of time we spend in our car since 1980 has over doubled. The number of friends the average American had has dropped from 3 to under 2 in the last year. It's very hard to live in America and be able to achieve this. So the situation is getting worse, not better.
One of the major factors that affects your longevity in the United States is your paycheck. When you just described a situation where people who would be considered below the poverty level are living well and longer. Because
the people in charge of healthcare in this country are aiming at the wrong targets. We spend all of our money, $5 trillion, on waiting for people to get sick and then trying to heroically fix them. In blue zones, they spend a fraction of that, so you don't need to be rich, in keeping these communities active and socially connected, and the healthiest food is the cheapest food and the most accessible food. And we're not going to get a different America until we shift that focus from spending trillions to make sick people less sick, to saying what really drives health at the environmental level and designing for a healthy America. That's the idea. If we take the great minds that are driving the healthcare system and shift them to designing environments where people will stay healthy, we'll get a much healthier America.
Dr. Hsu, for somebody who comes in healthy, what do you tell them in terms of longevity hacks? What's your advice to somebody who is, let's say, 45 or 35 with no chronic illnesses, but we know what happens over the next 20 years. What is your advice to that person?
So I once had a mentor tell me, be the doctor that your patients need, not the doctor you think you are, right? In that situation, I think it depends on that particular patient, or that particular person. Maybe this is not a patient encounter. Maybe this is just a friendship encounter, and we both got written a friendship prescription, and that's why we were meeting. And so for me, if they're in their 40s, this is prime time. I myself am in my 40s, and I have, over the course of the last few years, adopted a few kind of lifestyle habits that are both evidence-based, so rooted in, a lot of the evidence around blue zones, a lot of the longevity kind of research. So I have adopted, diet, exercise, weight training, resistance training in particular, and Also, I would tell people connection. Connection is so critically important and so easily kind of undervalued in today's, really fast-paced, fast-moving lifestyle. So if they're a professional, maybe like myself or yourself, it's so easy to miss the small opportunities along the way that we all have and we have in our everyday to have to find connection in others.
Dan, I think one of the problems we have is that we often think about how we solve problems in America at the very individual level. Which diet should I do? Should I do that gym membership? Which, by the way, I think you came a little too close to home with the whole gym membership thing. But if you were giving advice to somebody who wanted to take this seriously, what would you say to them?
First thing is learn to cook at home. You're not going to find healthy choices sustainably outside of your home. So, and what I mean by that, and I think especially for poor people, is get a pressure cooker or, again, I have nothing to do with the company, but I like Instant Pots because people are in a hurry. The first objection people will say to...
Do you use the fry mode?
I use the pressure cook mode. So I just did this my own little fun project, but I live in Miami now, and I got 20 inner city moms to come in, and I got them to commit to 10 sessions. And during that 10 sessions, they voted for the recipes, and they were all 100% whole food, plant-based, mostly beans and grains, but we made them taste explosively delicious. And we took some time to actually chop with them, assemble, put it in the Instapot, push the button, and then we let them get to know each other so they form some social connectedness in this lonely neighborhood. We opened the pot, we ate together, and then they took the leftovers home to their family where they could spread this healthy contagion. We followed up. 40% of them are still making that food 6 months later. So I think that's one of the best things we could be doing. By the way, if you're eating a standard American diet at age 20, your life expectancy is 11 years less than if you're eating a whole food, plant-based, not say you can't eat meat, you can eat a little bit of meat, but a blue zone type diet. 11 years. Tell me any healthcare plan that's going to give you 11 years of life expectancy, other than shifting from the standard American diet to simply cooking at home. Right here in Minnesota, if you live in Frogtown, Twin Cities, if you live in Frogtown, your life expectancy is 12 years less than if you move right down 94 to Seward. Seward, they're both home to poor people. But in Seward, there is a co-op, there's good public transportation, they have trees, there's a bike lane, there are parks. It's big for the Somali community right now, Seward. But I would say move down the freeway to a zip code that's healthier. It's probably the most powerful unconscious thing you can do to add years to your life.
Well, thank you so much for both being here. This was a fantastic conversation, and I hope we get to continue it.